The patient education and the nursing implication, companionship. With the elderly, most of them, if not all, their children are out, the homes, and have their own families. So most of them are at home by themselves, or you have some children are still there, they're living actually with their children. But companionship and partners, healthcare and disease management, you want to make sure that you're addressing the needs of their healthcare issues, their disease processes, and the management of those diseases. Stand up to date with their immunizations, the pneumonia and the flu vaccines, any medications that they're currently on. You're going to make sure you do medication reconciliations with them, especially if they're on two different kinds of blood pressure medications. You want to make them well aware of the side effects of those medications, how to take their blood pressure at home, and when to notify the physician about their blood pressures or blood sugars if they're on these types of medications. Any transportation issues, things like Dollaride and different parks and recreations that tailor to specifically to the elderly population. These are good programs that gets them out, takes them on trips. So you want to make sure your elderly population knows about the resources in their communities, and that they're able to easily access these services. Their insurances like Medicaid and Medicare, finances, any retirement if they're retired. A lot of the elderly now, though, are still working. My mom is in this age group, and she has yet to retire. She keeps saying she's going to, but she has yet to retire, and we're not like forcing her. She keep working as long as she would. Personally, I feel like she should, but she's not ready. So it's just up to her. So just appreciating the fact that they still want to continue to work, and just allowing them until they feel like they're ready to retire. But you want to make sure that you speak to them and make sure they get all their questions answered, and all the resources that they have with their employers regarding retirement and Medicare and Medicaid and these things after they retire. Everything is set in place prior to retirement, work and retirement, and then death and dying. I think that this is an issue for us all, not just the elderly, because that there happens to the young. So but the natural course of life, how we like to think of it, we would like to be here longer and longer until we get old. And this population particularly, they think about it more. The textbooks mention them as the ones that like to really be thinking about, okay, I'm getting close to that time, and so they most of them be preparing themselves for these things. So you just want to address their needs, whatever their needs are, their wishes, that they might have for themselves when they pass on.